Good morning. Welcome to Mornings with Loretta. Did you know, do you or someone you know have pain in the mornings or even throughout the day in their joints or their stiffness when doing everyday activities? These symptoms may be related to a common condition called osteoarthritis, and it affects over 32.5 million Americans. So, joining us now to discuss how physical therapy can actually treat and help people and help us manage these symptoms is physical therapist Dr. Sherri Betz. Welcome to the show, Dr. Sherri.
Thank you. Happy to be here.
Yes, I'm just going to jump right in there. So, what is osteoarthritis, and what are some of the common signs and symptoms to look out for?
Osteoarthritis is a condition that involves degradation, wear and tear of the cartilage or the cushion that's between the bones. People often experience this at the hips, the knee, the hands, or the feet, most commonly. And the symptoms that they feel are usually pain in the joint, stiffness in the joint that occurs more in the beginning of the day and progresses and gets a little better through the end of the day. And they also often experience creaking or cracking, which is known as crepitus in the joint. The good news is that when they have difficulty with daily activities and are limited by that joint pain, they can seek out physical therapy for some great benefits.
You know, I like that because I don't know if I've ever heard that physical therapy could help you with any kind of arthritis. And now we're talking about osteoarthritis. So what are the common myths regarding what people with osteoarthritis can do and what they can't do? Can you just help us just get rid of all of that so we can become more healthy and strong in our bones and in our minds?
Absolutely. I often feel that patients come in with these preconceived myths that they shouldn't be doing movement and they should be avoiding the activities that they really enjoy. And as a physical therapist, I want to get them back to doing the activities they love. And so we'll often start with water therapy, such as aquatherapy or swimming, to give them support to the joint, and then quickly transition them to land-based exercises such as cycling, which can help manage the symptoms of osteoporosis and decrease osteoarthritis and decrease symptoms in the knee. And they can also then progress to brisk walking, light gardening, dancing, and any other aerobic activities that they enjoy. And another thing that they usually avoid is strength training. This is so important to include in a program for osteoarthritis because the joint depends on muscular support for shock absorption and for transmission of forces. So the less strong you are, the more force you're going to have on your joint, and the more that cartilage is going to be affected in that arthritic joint. So you've got to be doing some strength training, and your physical therapist can guide you in the appropriate treatment program and exercise plan for that.
Oh, wow. So the more you talk and you explain things to me, now I have even more questions, but that's interesting because we always tend to think if we're already hurting, we need to just sit there. And then if we already have stiffness somewhere, we tend to just want to get up like we don't have the stiffness, and that could cause you to fall. It could cause a lot of damage, I'm sure. So, okay, let me ask you this question. So how do physical therapists treat and help people manage the symptoms of osteoarthritis in our day-to-day activities? Because I think we do tend to not want to use anything that hurts when we think it's helping, but as you said, it hurts.
That's right. So a physical therapist will perform a comprehensive assessment, and they'll try to identify some risk factors or some movement compensations. Sometimes you have some alignment issues, the way you weight bear on your feet. They'll identify some of those factors that are affecting the joint and try to help you reduce the forces on that joint, get stronger, improve your mobility, and put together a tailored exercise program to get you back to doing whatever activity you want to do, whether it's tennis, golf, go back to dancing, working out at the gym.
Okay, because I had a shoulder injury and they thought it was my rotator cuff, and then they wanted to do surgery, and I just did not want to have surgery. And then my and I didn't know you could be a doctor of physical therapy. So I've learned so much just getting ready for you. So thank you for teaching me that. And so there was some movement. He said, what happened, I was nursing it too much. So I would use and overcompensate on my right shoulder, which was really making this shoulder even more weaker and more injured. So I know what we think is counterintuitive, what you're telling me. So we need to use those joints and those muscles and do it
That's
under the
exactly
care of a physical
right.
therapist, right?
Yes. Your joints depend on muscular support in order to maintain their stability. We know that 70% of the shock absorption and support for, say, the knee comes from muscle. And when you stop doing things or eliminate activities from your daily routine, then you get weaker and weaker, which leads to actually more and more pain and dysfunction. I have a patient who had osteoarthritis of the knee, and it was pretty severe for several years. And she worked with me in physical therapy, doing a progressive exercise program where we were gradually increasing the amount of resistance that she could handle. And her goal was to climb the Spanish Steps in Rome with her family and go on vacation without being a hindrance to them. And lo and behold, she just told me last week that she was able to climb all 135 of those Spanish steps without knee pain.
Oh my goodness, all 135. That sounds painful, but I know it's so good for our joints when we move them. I know that to be a fact, Dr. Sherri. I know that. So why is physical therapy as effective, and in most cases or some cases more effective than a steroid injection for knee osteoarthritis? Why is that?
Yeah, we know from the CDC that 12.4 million people over age 65 have knee osteoarthritis. And some of these people elect to have multiple steroid injections. But in fact, a new report published by the American Physical Therapy Association compared physical therapy to steroid injections for knee osteoarthritis and found that physical therapy was actually more effective. And the report also calculated the economic impact and found that physical therapy saves close to $14,000 per episode of care. Another consideration for selecting physical therapy versus either steroids or, say, surgery, steroids actually are shown to reduce bone density and reduce tissue strength, making tendons more apt to rupture and bones weaker. And we all know how popular osteoporosis is, with over 44 million Americans suffering from low bone density.
Yes, and I know for sure I did not have to have the surgery, and I'm so glad I didn't have it for so many reasons, of course. But and eventually, as I did the physical therapy, Dr. Sherri, my shoulders started getting stronger, and now I have no limitation of what I can do with this shoulder, all because of physical therapy. So I didn't know I was going to have a testimony about this, but I did. And so now I have this. I broke my tibia fibula thing, in March, and I started just moving it because it was hurting if I wasn't. So they said, you could start putting weight on it. You could start doing whatever, don't overdo it though. And through physical therapy, my leg is so much stronger after at my age, two broken bones. So I want to tell you, physical therapy does work if you hang in there. And I like the innovation of physical therapy because you all use so many things that we already have at home or inexpensive items that we can do. Can you talk about the proper use of those? Because you show us in a clinic, but then we get home like those bands or a pool noodle or something like that. So how does that really work?
Yes, I love to give people home exercise programs with things they already have at home. I give people a broomstick. They can use it for balance. They can use it for aligning their spine by placing it against their head, their mid-back, and their tailbone, and doing squats and lunges and things like that, using the broomstick to unload their body a little bit. They can also use bags of sugar, flour, rice, beans, soup cans as weight equipment very easily. They can use a backpack, put a backpack on their back, and be able to exercise with providing that resistance. And one of the ways that I really got experience with that was during COVID. During the pandemic, we couldn't see people on site. So I was seeing people through telehealth and giving them instructions on go get a box from your laundry room and get your laundry basket, get a trash can, put your bags of sugar, flour in there, and use that as a deadlift. And so that they could use things that they already have at home and still be able to exercise and strengthen and stay strong.
Wow, I could go on and on, but I know I got to let you go, Dr. Sherri. Thank you so much. So where can we go for more information? Those are wonderful tips. And I have actually put that in a backpack to help during this journey of getting back to my full 100%. So where can we go for more information?
Go to choosept.com and you can enter any condition in the search terms and find a plethora of information about to help that condition. And also you can find where to locate a physical therapist in your neighborhood.
Awesome. Thank you so much, Dr. Sherri, for stopping by. You have helped me in these 10 minutes that we had. Like, I needed this. So thank you so much.
Oh, I'm so happy to hear that. Good luck to you. Stay strong.
Okay. Absolutely. You got to come back. Thank you, Dr. Betz. Bye-bye.
Happy to.
Hi, Brandy. Yes, good morning to you too. So let me tell you about Dr. Sherri Betz. She is the spokesperson for APTA, and she's a physical therapist and director of the Pilates Physical Therapy in Louisiana. She specializes in geriatrics and osteoarthritis, and she is devoted to improving awareness about geriatric exercise, home exercises, bone health, and safe yoga and Pilates-based exercises through professional and consumer education, as well as the promotion of low-cost, on-site, virtual community exercise programs. She mentioned that when she said things happened during COVID and she couldn't get to her clients and they couldn't get to her. So she serves on the Bone Health and Osteoporosis Foundation Exercise and Rehabilitation Activities Council. So she does a lot. So like I tell you, I only want to bring the best to you to help you, because let me tell you, these bodies got to last us as long as these bodies got to last us. And I want to make sure that we definitely are as strong and as healthy as we can. Oh, my dear friend, Vera Moore, the amazing actress, Vera Moore Cosmetics. You all go back and watch that interview I did with her. She said, thank you, Loretta. These are great tips. More hugs, Vera. So I want to make sure I always do this for you. Every show, whether it's fashion, whether it's health, whether it's mental health awareness, whether it's business development, real estate, whatever we're talking about, I promise you that I will bring on the best, right? The very best, because you deserve that, because you're the best, right? So we have another show coming up later today around 6:00, and I can't wait to see you there. Happy Friday, everybody. Think positive, dream big dreams, help someone along the way. And guess what? We'll see you very soon. Coming up next, we have a conversation with actress, writer, Karen Bankhead, and the infamous Miss Etta Mae Humphreys. We'll see you there.
Your life lives today.